I'm pleased to welcome Dr. Colleen Fogarty, the Medical Director at Highland Family Medicine and the Associate Chair for Interprofessional Practice and Education, back to the program. Great to see you.
Good morning, Mark.
So we're talking about organ donation today, and let me begin by asking you what inspired the topic.
Sure. You know, I was talking to one of my patients who's a Puerto Rican gentleman, and he was telling me that his spouse didn't want to check the organ donation box on her driver's license. And he said, honey, more Latino people need to donate organs because there's a big need in that population.
Let me ask you, and we've certainly talked about it a lot around these parts through the years, the importance of it. What types of organs can be donated?
So really anything, in particular some of the larger organs, kidney, liver, pancreas, but also different kinds of tissues, the lining of the eye, certain kinds of tendons and bones can be donated, and that's really at the discretion of the team after the person who's donating has died.
What type of choice does the person have to make before death, obviously?
Sure. So if somebody wants to become an organ donor, they can simply check the box on their driver's license application, or they can go to the New York State Donor Registration website and sign up. People can limit it to larger organs, a certain organ, or any kind of tissue or organ that's necessary.
Interesting. So you have options that way.
You have options, yes.
Give us a sense, from a medical standpoint, what kind of difference donating an organ can make?
Sure. Well, one organ donor can save up to 8 lives. And one tissue donor can save or improve the lives of up to 50 people. So there might be a part of an eye that's going to someone who's got an eye condition, or a part of an organ who's going to someone who needs an organ replacement.
And you mentioned your patient who is Hispanic and how important it is for certain minorities, especially Hispanics,
yes,
to really heed this message.
He's passionate about it, yeah, and really wants people to know that Latinos, there's a lower organ donation rate among Latinos, and that's unfortunate because there are many Latinos in need of particular organs. In New York State alone, there are 300 Latino patients in need of a liver and over 1,000 in need of a kidney at this time.
Think about that. Well, I tell you what, we'll leave it there, Doctor. Thank you.
Thank you.
Here's the website that we want to reinforce as we finish up: donatelife.ny.gov/register. It's as simple as that, to taking the step to becoming an organ donor. If you missed any of our conversation, we are sharing it, as always, on our site at rochesterfirst.com.